Hey Lake Nona, it's your Nona TV host Linnea Batiste, and I'm here at a new center right on Narcoossee that's combining neurology with physical therapy and changing people's lives right here in our neighborhood. So let's go inside and take a tour. Meet Dr. Gilbert Mbeo and Dr. Kennard Webb, the duo that's combining neurology with physical therapy right in our neighborhood. Care that stemmed from Dr. Mbeo's goal to give patients exactly what they need to have well-rounded care. So Dr. Mbeo, this is a beautiful office and area. We have physical, and then also we have the Brain, Spine, Pain Institute of Lake Nona. So talk about, what are these two entities? They look separate, but they work together. So talk about that.
Thanks for that question. So my name is Dr. Mbeo, and I'm the founder of the Brain, Spine, Pain Institute of Lake Nona and the owner of Fyzical Lake Nona. The institute is designed to be a one-stop shop for our patients with neurologic needs. So it's Lake Nona's Neurologic Institute.
So just talk about, why is it important to put them together? Because honestly, as someone who, I'm not in the medical field, of course, but I would never put those two together. But to hear you talk about it, it's almost necessary.
Absolutely. So physical therapy is the cornerstone of any neurologic patient's recovery. And many of our pain management interventions are centered around not only procedures and medications, but actually physical therapy. So when I look at physical therapy, it's the cornerstone to getting our patients better. Movement is medicine. And so having it under the same roof is vital to the patients getting better. So it's time to have some fun. Let's head over to Fyzical.
Welcome to Fyzical Lake Nona. Come on in.
So now we're here in Fyzical. We're here with Dr. Kennard, Q, affectionately called by so many patients. So talk about working here at Fyzical. What are some of the things that patients will be able to experience if they become one of your patients?
Really, the primary emphasis of Fyzical is its balance and therapy centers. So a lot of the emphasis is going to be on balance. We're trying to make sure that we're reducing the risk of falls and falls in general for Lake Nona, Central Orlando, and really just nationwide. So we're associated with Brain, Spine, Pain Institute of Lake Nona. So you guys noticed when you first came in, the pain is struck out. We're trying to make sure that we're minimizing, reducing, and making sure that people are moving around this area without pain.
So as a physical therapist, talk about how important it is to combine physical therapy with meeting with a neurologist and neurological services.
It's been a blessing. It's really something that I had never heard of prior to being a part of this team. And really, I think nationwide hasn't happened anywhere else. But really being able to work with a neurologist out in the outpatient facility and having that ability to communicate with him, that's been just integral to me being able to serve people that I'm working with, because we have that ability to talk about what's going on with them medically, but at the same time, what I'm seeing physically as well.
And Fyzical, with the Brain, Spine, and Pain Institute of Lake Nona, offers several duo therapy options for patients. Like for Aiden, he's using the SmartFit device and water therapy.
With Aiden, one of the emphasis that we worked on, again, was dual task. And so we've been using the SmartFit device. So it's a device where you see all those numbers and letters. And then not only is he thinking about the cognitive process of alternating from letters to numbers, but he's also thinking about the physical task as well. To go into the water, it provides buoyancy, but also that heat. That buoyancy and the heat together help alleviate any kind of pain that we may be having. And so we're able to do much more dynamic things there as well, like jog and run, whereas on the ground, that's still something that's very difficult at the moment.
And of course, Q and Dr. Mbeo wanted me to try something too.
Are you thinking what I'm thinking?
I'm thinking what you're thinking.
All right, let's do it.
Virtual reality.
Yes, you heard right. It's called Virtualis, and it's their virtual reality therapy tool that simultaneously builds cognitive and physical strength. What am I going to be experiencing neurologically? Because I see what I'm doing physically, but I will be honest, my brain is going all over the place.
So excited to do it, right?
Yes.
So virtual reality is immersive. So we're using this immersive experience to rehabilitate. We're making rehabilitation fun. So you're getting into this environment and you don't even realize that, as you play, you're actually healing.
Physical therapy, neurology, and play. So we're going to see how all this comes together.
I want you guys to see this. This is what she's actively seeing right now, okay? This is just kind of the play portion of it, but there's actual tests that are designed to look at your balance, how much of your visual system you're using, how much of your vestibular system, your somatosensory system, and that's how that integrates with the neurology part of it as well.
And then virtual reality truly is the future of medicine. So incorporating virtual reality, you see that a lot. And we saw it first at Fyzical with Nona.
Outstanding, yes sir.
Now the tour is over, and I have to say I truly understand now how physical therapy and neurology can work so well together. So make sure that you check out Fyzical and the Brain Spine Pain Institute of Lake Nona right here in your neighborhood. For Nona TV, I'm Linnea Batiste.